At Southwest Health, our vision is creating a healthier Southwest Wisconsin. And to that end, we want our employees also to be the healthiest version that they can be. Know Your Numbers is a part of our Big M initiative. You have the opportunity as employees to freely obtain various numbers to check on your health: blood sugar, cholesterol, blood pressure, and your BMI. So now let's take a look at those numbers and see what the normals are and what you can do to change them if they're not at the point that you would like them to be. So one of the numbers we're looking at is blood sugar. Your blood sugar level will tell you where you are in relation to normal blood sugar, pre-diabetes, and diabetes. The blood sugar will be checked after an 8-hour fast by a blood draw. So a normal fasting blood sugar would be 99 or less. 100 to 125 we consider pre-diabetes. Diabetes is diagnosed if your blood sugar is 126 or higher. Diabetes is a very time-consuming, life-consuming diagnosis, can lead to long-term complications. Unlike type 1 diabetes, type 2 diabetes can be reversible. So between you and your healthcare provider, you can develop the interventions that are necessary to help you keep your blood glucose level at the best level that it can be. Your lab draw will also provide you with your cholesterol levels. Cholesterol is an indicator of your risk for heart disease. You want your total cholesterol to be less than 200, your healthy cholesterol, the HDL, or the good cholesterol, to be greater than 40 if you're a male and greater than 50 if you're a female. The bad cholesterol, the LDL, or the lethal, we like to see that less than 100. And the fourth one is your triglycerides, and we like to see that less than 150. Heart disease includes the potential for heart attack, stroke, need for open heart surgery. So if we can keep our cholesterol levels as normal as possible, you can avoid all of those potential outcomes from heart disease. Blood pressure is another one of the numbers that we will be checking. A healthy blood pressure is 120 over 80. Now what does that actually mean? The top number refers to the amount of pressure in your arteries during the contraction of your heart muscle. The bottom number refers to your blood pressure when your heart muscle is between beats. Both numbers are important for determining the status of your heart health. When looking at your blood pressure numbers, your risk for cardiovascular disease, heart attack, stroke doubles for every 20-point increase in your top number and for every 10 points for your bottom number. There is a reason why hypertension is called the silent killer, because oftentimes there are no symptoms of a high blood pressure. So get that blood pressure checked and see where you stand compared to a healthy level. The next number we're going to be testing is your BMI, body mass index. So the way that you find your BMI is based on your height and your weight. You take your weight in pounds, divide by your height in inches, again by your height, and multiply by 703. If your number is 24.9 or less, that is considered a healthy weight. 25 to 29 is considered overweight. 30 or higher is considered obesity. The higher the BMI, the higher the risk for cardiovascular disease, high blood pressure, type 2 diabetes, and other chronic health conditions that can limit your quality of life. Knowing your numbers will help you get the most out of life. To register for Know Your Numbers, go to the intranet, the Drive, click on the banner, and make your appointment. A healthier Southwest Wisconsin begins with a healthier you.